University and a master's degree from the University of Buffalo. And if I may say, I had the pleasure of touring the Harvest House yesterday, and if y'all haven't been, you need to go check it out. It will move you in ways you wouldn't even believe. It's a very special place. So now, Brandy, I'd love to welcome you to the stage. Yay!
Good afternoon, everyone. It is an honor to be with you all and to speak about something that is very near and dear to my heart. Even as a young child living in Los Angeles, I understood the importance of health equity. At the time, however, I did not know the definition. I could only describe how a lack of health care led to people close to me dying young, and how their lives and circumstances contributed to that. As an adult, working at Harvest House has not only allowed me to articulate the importance of that, but to work alongside a team of dedicated individuals to show the impact of true health equity in community. For more than 30 years, Harvest House has invested in working with the greater community to build and facilitate person-centered solutions that have a positive impact on health, well-being, and quality of life. To help marginalized communities become self-sufficient and thrive. Our greatest vision is to help inform others about the importance of true health equity, and hopefully to help achieve that for every marginalized neighborhood. So that was a lot of words to throw at you. So let me expand on the work that we do. Harvest House is located on the east side of Buffalo. Many of you know the area because of the Tops Massacre. You may even recognize these names: Ruth Whitfield, Robert Drury, Aaron Salter, Hayward Patterson, Pearl Young, Geraldine Talley, Celestine Cheney, Catherine Massey, Margaret Morrison, and Andre McNeil. But there were friends, families, community members, and countless others who were directly and indirectly affected by the events that happened that day. That's the community that we serve. Harvest House is largely on the east side and an African American community that has limited resources when it comes to meeting basic needs. Most of the people that we serve are people of color, mostly single female-headed household, and mostly living at or below the poverty level. But what does that mean for health equity and access? It means that 50% of the people that we serve have no health insurance. And the 25% of the people that we serve who do have Medicaid can't afford their co-pays. 20% of that population goes to the emergency room for non-medical emergencies. And on a greater scale, these numbers contribute to the 61.4% of premature deaths and high infant mortality rates in the Black community in Erie County. Because of this knowledge, Harvest House functions under a trauma-informed leadership and social determinants of health model. This means that first and foremost, the people that we serve in this community comes first. The work that we do and the services that we provide not only are collaborating with the community, but are built in a way to help them heal and to empower them as well. We are actively working to hear and understand the needs and circumstances that have left them marginalized and help them to build solutions to inform change. And this is where the social determinants of health come in. Social determinants of health, if you didn't know, are all the things that a person needs to thrive in life. Those are access to quality education, access to quality health care, economic stability, social and community context, and neighborhood and built environment. But how does that relate to health care? All of these factors influence health outcomes. Within Harvest House, we have an education center, housing programs, free medical and dental services, a partnering mental health service, and a baby and children's ministry where people can get free clothes for their children. And I want to reiterate that all the services that happen at Harvest House are free or under stipend for the community so they can have access to the things that they need under the social determinants of health. Wrapped around that is our community navigators and our trauma team, who work to provide access and support for barriers and help them heal inside and out. I want to take a moment to acknowledge our CEO, Carol Murphy, and outreach specialist, Tiffany White, as part of that team. Staff, students, partners, and volunteers are all trained first and foremost in trauma-informed care to be able to provide support and linkage to patrons, and also to provide service with dignity. From there, our team works collectively alongside 25 other community partners to assure that a person coming in can have most, if not all, of their needs met through the social determinants of health in one place. That means that when a mother comes in with diabetes and she's also struggling with housing and job attainment, we know that there are several components that are needed to assure that a person can and will be able to maintain their medication regimen to remain healthy and care for their family. And in turn, alongside caring for their family, they'll also be able to contribute to their community, to the economy, and also break the cycle of violence for themselves and their family. Healthcare goes beyond insurance. For us, it is understood that caring for people and the whole person is important in healthcare, and not just its parts. I want to share a Harvest House story with you that highlights a little bit what I mean. So on one of our medical days, Kaylee McDonald over here, she is our diligent medical clinical coordinator. She called me and she asked for the trauma team to come over to the medical clinic because there was a woman there and she was screaming and hysterical. So we took her to our healing space within our building, and we helped her calm down, and we talked to her about what she needed. She informed us that she is a mother of two, and she's in a domestic violence situation. As we were talking with her, we also saw that she had been beaten, and a couple of her teeth were loose in her mouth. So that day, she not only received medical care and dental care, But she also shared with us that she wanted to escape her abuser. So we connected her with our housing team, who connected her to a domestic violence shelter. But that wasn't the last that we saw of her. She continued to work with us. And now, she is living in her home, free from her abuser, thanks to the support of our housing team. And she has a job where she's making $30 per hour. Let me take that back, a career that she actually loves, where she's making $30 an hour. Because of the support that she got from our workforce development program at New Hope. And in addition to that, through our partner, Operation Hope, she was given the financial tools that she needed to be able to financially secure her finances for herself and her children for the future. This is health equity. And it is not just achieved within our building. Many countless others outside of our partners and from across Western New York who believe in our vision, give to this community through donations, volunteerism, and support daily. They know, like you, that health equity cannot be achieved in a vacuum. It takes intention and collective action. Your voice is significant, and your actions make a difference, whether it be through donating and volunteering or through education and learning and voting on health access. I truly believe that if we collectively move forward towards this goal, holistic healthcare access for all can be achieved. Thank you.
See, I wasn't kidding. Thank you so much, Brandy.